What can you do to help your body make the best possible scar? So, unfortunately, after we're born, whenever a part of our body is injured, for the most part, that tissue heals with a scar. That happens inside your body and outside your body. Now, inside, you don't really see that scar tissue. What you see is scars on your skin. So in plastic surgery, our goal is to minimize the scars you have. We also want to hide the scars in less noticeable locations. And finally, we want the scars to heal up as nicely as possible. So we approach scars differently depending on where they're located. So let's start with our faces. So on our faces, the skin, believe it or not, doesn't move a whole lot, and it's not under much tension. So that is why usually our faces make nice scars. What you can do to make sure your face makes a nice scar is avoid the sun, and if you can't avoid the sun, put lots of good sunblock all over your face, especially over the scars. Make sure it has UVA and UVB protection, or broad spectrum. You really want to prevent or protect those immature fresh scars on your face from being exposed to ultraviolet radiation. It's forever, I have to tell you that because I'm a doctor, but especially for the first year, and especially for the first few months. All right, so that's sort of your face. There's really not much else to do on your face. We want to make sure we get the stitches out, if there's any external stitches, in 5 to 7 days so we don't leave suture marks. Another thing we want to do is keep them moist. So keep the incisions moist with bacitracin or Aquaphor. Don't use anything with Neosporin in it. It'll make the incision turn red and get kind of angry. And that's about it. You can keep it clean. Warm soapy water like Dove soap, a nice gentle soap. If it's kind of crusty with some blood or blood clot, you can use some hydrogen peroxide to help dissolve that away. But in general, hydrogen peroxide is not good for healing, but it's okay to use a couple times to help get the blood dissolved if you had any blood build up. About the face, that's about it. So keep it clean, keep it moist, protect it from the sun, make sure the sutures are all out in 5 to 7 days. That's the big thing for facial scar healing. Now, if you have staples in your scalp, because staples are what's best for scalp healing, your plastic surgeon may leave those in a little longer than 5 to 7 days, so don't get confused with that point. Another thing is, if you have sutures behind your ear, like in a facelift, those sutures generally dissolve and don't have to be taken out, but that's okay because nobody can see the incision tucked up behind your ear. Let's talk about scars on your body or breasts. So that's a little different. On our bodies, breasts, abdomen, thighs, arms, everywhere else, the tissue is under more tension. Because almost every reason you would have a scar on your body from plastic surgery is to make your skin tighter. Whether it's an arm lift, a tummy tuck, a thigh lift, lower body lift, any of those things, the goal is to probably make your skin tighter, and therefore those incisions are under higher tension. So we can't really change the tension factor. The only way to make it under less tension would be to make your result not as good by leaving your skin looser, and that's not what you want. So the tension factor is what it is. What you can do is position yourself so that you don't add tension to the incision. So if you had a tummy tuck, you want to make sure that you sit in the reflex position, kind of with your knees close to your shoulder, to take tension off that incision as much as you can. That will help it a lot. Because think of it like this. In order to make a good scar, you want to maximize the blood flow. Having good blood flow to those skin edges so that they can heal is super important when you're healing a skin incision or anything for that matter in your body. So things you can do to help maximize healing are to maximize blood flow. So avoid any and all nicotine, drink lots of fluids, Gatorade, stay well hydrated, take your pain medicine. So if you're anxious about anything and you're in pain, that's going to make your sympathetic nervous system go up, which is going to make the blood flow to your skin go down. So try and keep as comfortable as you can while still being safe with the pain medicine and not taking too much. Stay well hydrated, position your body to help minimize tension on the wounds, avoid any and all nicotine, and those are some big things you can do to help maximize blood flow to your healing incisions. So on the body, you want to position yourself to help minimize tension if that's possible. Avoid anything that would decrease your blood flow to that tissue. And eat lots of protein. Those are the big things. What we also have people do is on your breast and body scars, you're going to have steri strips. When those fall off, we're going to give you paper tape to put on those incisions. Motion adds to scarring. So what we're trying to do is decrease the motion. So think of it like the motion like this on that incision. We're trying to minimize that motion to help your scar look better. And tape and steri strips do that. So when the steri strips fall off, we're going to have you do paper tape until you hit the 6-week mark out from surgery. You're just going to keep putting on the paper tape until you hit 6 weeks. When it falls off, put on more. And at 6 weeks, then we laser the scars to help get that redness out of them. So that's sort of our protocol for scars. So on the face, keep it moist, keep it clean, avoid the sun, sutures out 5 to 7 days. On the body, tape and positioning yourself to minimize tension if possible, and making sure you have good blood flow to the skin as well as protein. You're eating protein so you can heal are the best ways to help maximize your scar result, or in other words, make your scar look as good as possible. A final point I want to make is that we will do everything we can to make your scar look as good as possible, but a lot of how a scar looks has to do with how your body heals it. So if your body starts making a hypertrophic scar or a keloid, then we will take care of it by injecting medicine, and I'm not going to go into that right now. But in other words, we will do our best to make sure your scar looks as good as possible, but we can't control how you heal. One last point I want to make is don't use chlorhexidine soap after surgery. I've had patients who use the chlorhexidine soap that we have them bathe with before surgery. They use it after surgery, and that's not good. Your healing incisions don't like chlorhexidine. It's too strong of a soap for healing incisions. So only use that soap before surgery, and then after surgery, use a mild Dove soap. I hope you found this helpful. Please check out our website, restoreplasticsurgery.com. There you will find a price estimator that can estimate the cost of any combination of procedures that you might be interested in. You can also use our virtual consultation tool. It's essentially a way for you to send us your concerns along with photographs of your concerns, and we will respond with an assessment and our recommendations. On our blog page, there is a recording function called the Speak Pipe, and it's a place where you can leave audio recordings of your questions and things you would like discussed on a future episode. Finally, please follow us on Instagram and Facebook, and also check out our YouTube channel. Subscribe to the YouTube channel if you're watching this on YouTube right now. And lastly, we also have a podcast, Plastic Surgery Q&A, and you can subscribe to that podcast and listen to those episodes at iTunes or wherever you get your podcasts.